This is a model called SAFTE. It's a model that tries to link together sleep, activity, fatigue, and task effectiveness, designed to produce results that would guide decision makers about how to get people on shift work when they're working at night to be the greatest degree of alertness so that they can do their jobs well. They're not considering some of the psychosocial factors or some of the other convenience factors in terms of shift work. On the right is the effectiveness compartment, how well you can do your job. And the effect of this compartment is due in part to the circadian effect, which will determine how wide awake you are. And the other is the sleep reservoir, how wide awake you are. Mainly counts is how much sleep you get, whether you have sleep debt, whether that would indicate how much sleep you're accumulating to fill up your sleep reservoir. It seems to be pretty useful in terms of understanding how you might improve performance on shift work by increasing the amount of your sleep reservoir and your effectiveness. What this is an example of, it's a typical shift cycle showing 2 cycles of day work, and the day work, of course, showing very high level of effectiveness. And the evening work has a little more variation in terms of effectiveness in the model, but then followed immediately by 2 nights on night shift, each of 8 hours. In fact, as you can see on the bottom, there's each of the red lines represents the shift work, and the blue lines represent the time of sleep. So by introducing the amount of sleep that the worker gets in between the shifts, it would be an indication of how much they've been able to make up their sleep deprivation and increase their effectiveness. What happens when the circadian rhythms are severely disrupted? In this case is a model that was prepared to look at a railroad collision, to model the state of effectiveness of the driver at the time of a collision. All of the shifts were night or early morning shifts, and if you look at the blue bars at the bottom, there are several indications that the worker had disrupted sleep. This type of model is used to investigate transportation accidents. There are apparently a whole series of models built up for transportation accidents. People are not good at judging how awake they are. This shows the result of an experiment, or a series of experiments that were done. On the left is a chart of the actual sleepiness of people under 3 conditions. The chart on the left shows people who were in a controlled environment, kept away from light and dark. The people on the green line were allowed to sleep 8 hours a day. The people with the intermediate yellow line were allowed to sleep 6 hours a day, and the people with the red line were allowed to sleep 4 hours per day over a prolonged period of time. But there is increasingly large effects of sleepiness measured by their vigilance, by their ability to respond to signals when they're tested. On the right is the self-rated sleepiness, how sleepy these people felt when they were doing the testing. And there's a tendency for people not to realize how sleepy they are, and that this, of course, has an effect in a lot of transportation situations and some shift work. Now, from this type of model and the research that's been done, I compiled a list of what seem to be the shift work good practices. Now, I've divided it into 2 parts. This part is fatigue and effectiveness. If you want to keep people at maximum indication of alertness, so that, and especially for jobs in the military and aviation and so on, is that you want to minimize disruption to circadian rhythms. Now, in effect, that's the primary principle, and the others are a way to do that. forward rotation of shifts, and we'll look at what a forward rotation shift is. It's basically day, evening, night, which follows the body clock. Short shifts, generally not longer than 8 hours, to minimize consecutive night shifts, to allow plenty of time to recover after night shifts, at least 24 hours after night shifts. Avoid long periods of sleeplessness. Make sure that people sleep when they're off shift. And finally, to have at least 2 days a week off on average so that you can recover. The other side of the shift work good practices, as I compiled them, was psychosocial. The things that make it more tolerable to be on shift as opposed to the ones that make it possible to do a good job while you're on shift. That the shifting should be predictable, that you know well in advance what the shifts are going to be, as much time off on weekends so that you could socialize with your family and your friends, have good quality time off, and equity for all workers, flexibility to be able to make changes in your shift, employee participation in design and implementation is a factor in making shifts tolerable, and then education and training to ensure that you're best able to, in terms of sleep and planning your life, to tolerate the shifts. You generally can't attain all those principles, all of the effectiveness and fatigue principles and all the psychosocial principles within one shift system. Now, as has been mentioned earlier, there are various kinds of shifts. There's the fixed or permanent shifts, all days, all afternoon, all nights. The most common shift pattern is various types of rotational through the day, 8-hour shifts or 12-hour shifts. Split shifts are quite common in things like bus drivers, people who work in the morning and then in the late afternoon. And then various kinds of irregular shifts and on-call shifts, which are often for public safety or emergency responder type, people who respond to environmental and chemical accidents and so on. Now, in terms of deciding how long a shift should be, a particular shift should be, the characteristics of the work done on shift to be considered, the intensity of the work, the pace, the physical load, the mental load, and particularly the consequences of error, and then the availability of breaks, rest, relief. We're looking at some of the characteristics of shifts. One of the most important is the speed of rotation. How many shifts in a row before there's a change? Fast rotations are up to generally 2 or 3 shifts, say 2 or 3 days, 2 or 3 evenings, 2 or 3 nights in a row of the same period. Shifts which are 4 to 10 shifts in a row before a change are generally regarded as slow, and then the very slow, where the shifts are like weeks at a time of the same time period. So a fast rotation, that is 2 to 3 shifts before a change, a fast rotation, they have the least effect on the circadian rhythm because you're on it, you're in it, you're off it. You've changed. And so there's very little adaptation. There's very small sleep deficit that can be made up. Two nights with on-night shift that can be made up in a day or two. There is reduced performance on the night shift, but because there's no adaptation, it means when you get off shift, you feel okay. Your social life is still okay. You can do the regular family and social things. Slow rotation seems to be sort of the worst of both worlds. Now, the very slow rotations, either permanent or very slow, the adaptation occurs, but the literature says that nobody ever completely adapts to night shifts, and the performance on the night shift gradually increases after the first 3 or 4 days. But there can be quite serious psychological effects based mainly on isolation and separation from family and lack of social effect. the least effect of rotation comes from the fast rotation with minimum accumulation of sleep deficit. One great advantage is that there are weeks that every week has at least some free evenings when you're on a fast rotation. You don't feel too separated from people, but there is some reduction in the performance. And the very slow rotation has the advantage that there is a better, there's some disruption of rotation, circadian rhythm, but the performance during the night shift can be better on the slow rotation. But you do have the problem. You have weeks without free evenings, and there is some sleep deficit. Now, in terms of shifting, from whether to shift forward or back, the factor is that for most people, the body clock is actually longer than 24 hours. Our body clock is synchronized to light. It's easier to have a forward rotation that adapts to the body clock. There is certainly a case to make for 12-hour shifts or 24-hour shifts, especially in situations where there's a variable or lower load, or where there's the availability of breaks and so on. The particular advantage of longer shifts is that there's more days off, there's less commuting, and there are fewer shift changes. But it means also that it's more difficult to get people in for things like training, and there can often be more fatigue from a longer shift. And there's certainly evidence that people have more accidents. And just a couple of cases at the end. Case one, a hospital shift, common nursing schedule. The problem that sometimes occurs with this type of shift is that there's, for example, here in week 4 going to week 1, you've got 1, 2, 3 cycles of continuous night shift, day shift, night shift, day shift. By changing a shift like this so that it's continuously alternating between night, day, night, day, night, day, the circadian disruption is lessened, and people will find it a little easier to adapt. And then finally, another case. Now, this is a relatively typical kind of manufacturing schedule. It's a series of 8-hour shifts, of the day, afternoon, and night. A rapidly rotating schedule, day followed by afternoon, followed by night, followed by days off, so that the night is always followed by days off. It's a forward rotation from day, afternoon to night. This is a 9-week cycle. So if 9 people are in this cycle, everybody will work. There'll always be 2 people in this cycle, always 2 people on at each shift, and everybody rotates through the full 9 weeks. A problem sometimes with a shift like this, it doesn't have that many full. In fact, I think there's just two weekends in 9 where the worker gets all the days off. So an alternative shift to that is an 8-hour, like this one here, is a 5-week cycle. The advantage of this 5-week cycle is that there's two full weekends in 5 instead of 2 full weekends in 9. So that it is possible to reorganize schedules depending on the preference of the workers. And a few final words. Establishing schedules is a really complicated process. There are lots of software now available for establishing schedules. The factors to consider: low workload, the pace, particularly the number of breaks available, looking at the fatigue effectiveness model, making sure that the workers and the supervisors are involved, not just the managers, and that employees are trained and they have knowledge about what that schedule is doing for them, and so they have some choice about the trade-offs they've made.